Bismillahirrahmanirrahim. Assalamu alaikum. Dear students, today in this lecture we will study the topic of blood transfusion reaction, how the blood should be transfused, what precautions should be followed, and what complications can occur due to the mismatched blood transfusion. For better understanding about the blood transfusion, firstly, we should discuss what is the origin of agglutinin in the plasma. The agglutinins are gamma globulins and are produced by bone marrow and lymph gland cells that produce antibodies to any other antigens. Most of them are IgM and IgG immunoglobulin molecules. Small amounts of type A and type B antigens enter the body in food, in bacteria and by other ways. And these substances initiate the development of the anti-A and anti-B agglutinins. Neonates has few if any agglutinin. Now we will study the blood transfusion. Not only in case of any accident, the blood must be transfused to the patient, but also for the purpose of blood donations to save the life of others, we require the blood transfusion to the patients. This therapeutic process is one of the most important life-saving techniques. Indications are to replace the blood loss due to injury, burns, surgical operation, or anything else. It is also indicated in certain anemias, aplastic anemia, thalassemia major, or like that disease. Recipient RBCs are not agglutinated because plasma of donor blood is diluted. But recipient agglutinin can agglutinate mismatched donor's blood. When bloods are mismatched, agglutinin attach themselves to RBC. Agglutinin have two binding sites, IgG type or 10 binding sites if the type is IgM. A single agglutinin can attach to two or more RBCs, causing the cells to clump, and the process is called agglutination. These clumps plug small vessels throughout the circulatory system and create a great problem. Then either physical distortion of cells or attack by phagocytic WBC destroys the membranes of the agglutinated cells, releasing hemoglobin in the plasma, and this process is called hemolysis. When bloods are mismatched, immediate hemolysis occurs due to activating the complement system, which releases proteolytic enzymes that ruptures the cell membranes. So immediately we can have acute hemolysis in some transfusion reaction. This acute reaction can lead to sudden death. So students, you must take care about the blood transfusion. Immediate intravascular hemolysis is less common because there have to be high titer of antibodies for lysis to occur. Another type of antibody is required, mainly the IgM antibody. These are called hemolysin. This is the table I want to show you for the safe transfusion. In this table, you can easily check that the blood from these groups can be given to these groups to have the safe transfusion. So before transfusion, you must check the blood group of the patient, of the donor and also the recipient, and then transfuse accordingly. This is a very nice animation to show how who the blood is for: A positive and A negative, B positive and B negative, O positive can be given to O positive, A positive, B positive and AB positive, as it is the universal donor as A O negative. So you can give that one to all types of the blood. For AB positive and for AB negative, you can give relevant blood groups. So through this animation, we come to know about the exact blood transfusion, from what will be the blood group of the donor and what should be the recipient for the safe transfusion. And through again this table I am showing you that either the reaction will be there or not. So go properly according to these tables and animation to have the safe transfusion. Otherwise, we can have one of the incompatible blood transfusion effect. So, any type of the complication can occur. Immediate, strong anaphylactic shock can occur. Anaphylaxis can occur, hemolysis of the RBC, which can lead to the death, sudden death of the patient. So, be careful about the blood transfusion. When whole blood is injected intravenously into the patients, serious symptoms and even death can occur if the recipient serum contains antibodies, which agglutinate the donor's red cells. Red cells are first agglutinated and then undergo hemolysis. One of the following reaction can take place. The injected RBCs are rapidly destroyed, the recipient blood returning within a week or less to its pre-transfusion state, and no other symptom can be observed. I want to tell you one important thing about transfusion reaction, that it depend upon how much the blood transfusion is there, how your body or recipient body is going to react. If a very little amount of the blood is injected, it can create no problem. But if massive blood transfusion given in case of accidents or any other specific disease, it can result in mismatched blood transfusion can result in sudden death. So it is regarding the sign and symptoms complication, it is not fixed. It depends upon number one thing, the amount of blood which is going to be transfused, and also how your body is going to react against this transfusion, plus the underlying cause. If there is an injury, then your body behavior will be different. If there is any specific underlying disease process is there, so our result will be different. So go according to all these points. All these things on complications, they are not fixed. Sign and symptoms. Sign and symptoms, that is not fixed for all. We can have one of these. For example, post-transfusion jaundice can occur, hemoglobin urea and renal failure can occur. which is a very, very serious condition. The volume of urine is greatly decreased due to in part of a fall in arterial blood pressure, perhaps to local vascular disturbances in the kidney leading to grave reduction in the volume of glomerular filtrate. Latent uremia can occur and renal tubular causing hypokalemia can occur. All these complications can occur with some of the other risk of the blood transfusion can also occur. For example, it has been seen that stored cells lose potassium to the plasma and that about 48 hours are required before the potassium returns to the red cells. In the cases of massive transfusion, a real risk of the patient dying from the hyperkalemia is there. In fact, it has occurred in replacement transfusion for erythroblastosis fetalis, which is a very specific disease, and in the next lecture we will discuss in detail. So all these effects can occur with the non-hemolytic febrile reaction. Allergic reaction can take place, headache, nausea, vomiting, or symptoms like itchy rash, throat or tongue swelling, shortness of breath, hyperkalemia, hypocalcemia. Transmission of the infection can also take place with the hemocytosis and circulatory failure. So all these things, they are not fixed for one patient. Depending upon the factor which I repeatedly told you, so they vary. Maybe one of them can occur or maybe altogether or 3-4 combination. So it must be you must remember that before blood transfusion, always check the blood group and its RH factor, and you must have the cross matching of the donor and the recipient. Only before transfusion, cross matching can save any type of the complication which can occur. So with this we complete our today's lecture, and inshallah we will discuss the topic of the blood group and transfusion and the RH incompatibility in the next lectures. So till that, keep with me and keep watching my lectures. Thank you. Allah Hafiz.